Don't walk into NCLEX without knowing this. PICC versus central line. Let's go. NCLEX loves asking questions about lines, accesses, infection risks, and what the nurse should do first. And students mix this up all the time. So a PICC line is a peripherally inserted central catheter. That means it's inserted through a vein in the arm, but the tip ends in a central vein near the heart. Now a central line is usually inserted into major veins, like the jugular, femoral, or subclavian vein. Now here's where NCLEX gets tricky. If the question mentions arm insertion, long-term antibiotics, TPN, difficult IV access, outpatient therapy, I need you to think along the lines of a PICC line. But if the patient is critically ill, in shock, on vasopressors, unstable, or needs rapid central access fast, I need you to think along the lines of central line. Now let's talk safety, because this is where NCLEX is going to zero in on. Both require sterile technique. Bloodstream infections are serious with these. Never force flush resistance, and always assess for redness, swelling, drainage, pain, or fever. But also keep in mind that NCLEX loves tying complications with these. So maybe you'll see something along the lines of air embolism, central line infection, catheter occlusion, pneumothorax after insertion, and sepsis. And dialysis nurses, this matters big time in our world too. Some dialysis catheters are central venous access devices. So with that being said, infection prevention is huge, because one contaminated line can become a bloodstream infection fast. And one more thing, NCLEX may test you on a PICC line being generally safer for long-term therapy versus repeated IV sticks. So with that being said, when you see long-term antibiotics, frequent infusions, or poor peripheral access, your thinking should shift to PICC line. Hey guys, I don't need you to know everything, but I do need you to be safe, prepared, and teachable.